Hi, I'm Amy Waterman, a transplant psychologist and the creator of the Explore Transplant Education Program.
And I'm Christine Lee, transplant coordinator.
We are so pleased that you want to learn more about being a kidney recipient. People ask me, is dialysis the same as getting a transplant?
I answer these questions every day. Dialysis can only do about 10 to 15% of what a normal kidney does. A transplanted kidney will restore kidney function up to 50 to 85%. It also works 24 hours a day, so patients feel a lot better. People ask me all the time, what would my life be like afterward?
And that's a question I can answer. I tell them that transplant recipients can eat and drink more freely. They love to drink lots of water after the transplant. They also are more energetic and have more freedom to do what's important to them, like travel or go back to work.
This video, What You Need to Know About Kidney Transplant, will answer many more questions and share stories of transplant patients.
We'll join you afterwards to talk more.
If I were a kidney recipient, what would I have to go through? What would my life be like afterwards? These are very common questions for patients exploring transplant. On this video, kidney recipients share what it's like to be evaluated for transplant, to undergo kidney surgery, and to live life with a transplant. Medical professionals also answer common transplant questions.
John, you've been on dialysis now going on about 8 months. What are some of your thoughts about transplant?
Well, I've thought about it, but I'm not sure if that's the right option for me yet.
It is okay to stay on dialysis, provided you have gone to a physician, gone to a transplant center, talked to your nephrologist, and you understand what are the options which are available for you, and you know what are the upside and what is the downside of all the different options. And if you consciously make a decision that, yes, I know everything about transplant, I do not want to get it, I want to stay on dialysis, I think that is perfectly all right. But a lot of times when I talk to people or talk to patients, I kind of get a sense that a lot of people don't know different options that are available. You know, when I tell them the facts about transplant, they suddenly say, nobody told me this.
What do I need to know about getting a transplant?
When deciding whether to get a kidney transplant, it's important that you understand all the possible medical, psychological, and financial risks. You can stop pursuing kidney transplant at any point if you decide this is not the right decision for you.
My doctor's recommendations about getting a transplant, he said, based upon how active you are now and personality, he says you're in great shape except for having this bad kidney. He said, I think you would be a viable candidate.
Hey, Daryl, how are you? How are you been? Good. Just coming here to talk to you a little bit more about this issue about transplantation. Just trying to compare how life is and how life could be. What limitations do you have for daily activity right now? What things you cannot do that you would like to do?
Drink a beer. Coca-Cola, Big Mac. Walk into a restaurant and don't have to worry about, I can only eat this little bit. Just drink some water. That's a blessing. And it might sound funny just to pee again.
The reasons to have a kidney transplant are you're going to feel better, you're going to be able to drink more fluids, you can travel, you don't need dialysis, and you're going to live longer.
I appreciate dialysis, but what is the next step? Dialysis is still not allowing me to live the life that I want to live, and I want to go back to as close as that normal life I was living. So I wanted to know what were my options. And when I found out transplant was the closest thing to a cure and feeling as best as I can the way I used to feel prior to dialysis, let's do it. Sign me up.
The reason that people live longer with a kidney transplant rather than with dialysis is because a kidney transplant gets rid of the poisons better. Dialysis approximates about 10% of total kidney function. A good functioning kidney transplant can be 50 to 85 and sometimes even 100% of kidney function with one kidney.
When I was on dialysis, I said, I think I'm too old to have a transplant. But anyhow, I talked to him, and he probably say, what's the oldest person that you've known that had transplant? He said 76. I'm still 72. I can still do it.
But we think that transplant is a good option for a lot of people that really don't think that it would be a good option for them. They think they're too old. They think they're too sick. You may have been sick in the past, but it's how is your body now? Can we do surgery now?
Having diabetes didn't limit me from getting a kidney. It, because diabetes caused it. It caused my kidneys to fail.
You can have a kidney from a person who's living, a living donor. That living donor can be your relative, can be your boyfriend, can be a church member, can be your cousin. There's so many people who can donate a kidney to you when they're still living. There's also a deceased donor. A deceased donor kidney comes from a person who's passed away and has donated the organs for transplantation. So I wanted to make sure that you call a transplant center and be evaluated.
Find out if you have any willing living donors. Get a referral from your doctor to get on the transplant waiting list. And notify your insurance if you have insurance, and get the ball rolling.
Sounds like you're kind of interested in transplant. Sounds like you'd at least be interested in getting a deceased donor transplant?
Yes.
Okay, so we need to get you on the list for that, first of all. I've told you that medically you're going to do better the sooner you get a kidney transplant. The average time to wait for a kidney transplant now on the waiting list in the United States is about 4 years.
I decided to get on the transplant waiting list because I wanted a kidney. And if I'm going to be on dialysis and waiting for something, that seems like the best possible thing to wait for, a new kidney.
When it came down through the process that I was really to a choice of either having my daughter donate the kidney or going on a list with a beeper, it really was at that point meeting with my daughter and finding out that she really wanted to do this. She wanted to do this more than I didn't want her to do this.
Can I get a transplant faster if I have a living donor?
There are advantages, usually because you know exactly when your testing's done and the donor's testing is done. You can plan for your job, you can plan for family members that might want to come in. It usually is a faster process, although the donors get a complete workup also. They get testing to make sure it's safe for them, because this isn't surgery they need to have. They're doing it out of the goodness of their heart for somebody else. So it's usually a faster process, and everything is planned, and you can kind of plan your life around what's going to happen.
If I decide not to be a living donor for my friend, you mentioned like a transplant waiting list. How would that work? How does that work for her?
She would take the initiative, and we want her to call the transplant coordinators and let her know that she's interested in going on the waiting list. Once she makes that initial decision, a very active decision, then they will follow up with her, and she would go in for a series of testing.
So you're saying that she wouldn't not get a kidney because she's African American?
No.
As long as you are eligible to get on that list, as long as you are on that list, your name is there with everybody else.
This particular doctor, she would come to clinic every time she come to clinic to, for the visits. I think she came on every Wednesday, and she would always ask me. She said, "Tyrone, have you gotten on that list yet?" And I said, "No, I haven't." And I just thought I should get on that list, and that's the best thing I ever did when I went and put myself on the transplant list.
In order to make the right decision, you have to be educated about the facts of transplant. That's our job at the Transplant Center. Your job is to call us and ask whether you could be considered for a kidney transplant.
When I decided that I wanted to have a transplant, I called a transplant center, and that's how I started getting enrolled. The transplant center took my call, and that's how I started my evaluation.
You have to go down and have the team at the transplant center interview you. They ask you a lot of health questions. They type and cross-match your blood to get a match.
The first test they gave me was they took 15 vials of blood. That was my first experience, which did not bother me whatsoever. I thought the ball is rolling now. This is where I wanted to be. And then after that, it was just a host of other tests. They checked me from one end to the other, you know.
Today we're going to do the EKG that tells us your heart rate and rhythm. We're going to do the chest x-ray that's looking at your lungs. And we're going to do a lot of blood work that tells us everything from how anemic you are to how good or bad your kidney function is, to what viruses you've been exposed to.
Hi Francisco, my name is Martha. I'm your financial coordinator. Anything to do with insurance issues is me you're going to contact.
I'm a little concerned about the cost of the transplant. What can you tell me?
We have all the details of your transplant benefits here. We're going to review all of your out-of-pocket costs because there's a lot more costs involved than just what your insurance is going to cover.
How could getting a transplant affect me financially?
The cost of the medical test and surgery for kidney transplants are covered by Medicare and your private insurance. However, you might have to take vacation time from work or pay for things like childcare, gas, meals, parking, hotels, and those would not be covered. Receiving a kidney transplant may also impact your ability to obtain or afford health or life insurance.
Who would pay for the cost of the anti-rejection medication?
Most of the anti-rejection medicines, which can be expensive, are covered by Medicare for 3 years following transplant surgery. If you're over the age of 65 and have Medicare, Medicare will continue to cover the cost of most anti-rejection medicines for the life of the transplant.
I am over 65.
Good, so this would apply to you.
Yes.
So for the patients that are under the age of 65 and receiving Social Security disability for medical reasons other than kidney failure, they also may be entitled to additional drug coverage past the 3-year period.
I have here a list of all the medications that you could possibly be on. I'm not sure which ones you're going to be on or not, but at least you'll have some idea. We're going to review what your insurance covers and doesn't cover. And then if you find that maybe these copays are too large or you're having any issues, you should be contacting us. We have a lot of resources that we can tap into to help patients pay for those copays. There's just so much help out there, and we can't help you unless you let us know you need help.
There's ways to get the medicines. You can get it through your medical or Medicare, or once you start feeling better, you get a job and then you start working for insurance, and then you'll get your medications through that.
The hardest part of the evaluation was to get the final answer that says yes.
Dr. Ross, you mentioned something about that this procedure was developed here, and that sounds very experimental to me, and I'm kind of concerned about being experimented on.
Sure, this is far from experimental, Kathy. This whole process of donation and transplantation is over 50 years old. The actual procedure of doing laparoscopic nephrectomies is only about 10 years old, but still, when you consider that almost 10,000 of these procedures are conducted yearly, that's a significant amount of experience.
How long will the surgery take?
They're going to be seen by a group of doctors, the anesthesiologist and the nurses. After they look over your records, they are going to take you to the operating room. The operation consists of just putting your new kidney in.
Okay.
It takes about between 2 and 3 hours. From the time that you walk to the room to the time that you get out, it takes between 3 and 4 hours.
Okay.
The procedure per se, it will take about 2 to 3 hours, depending on how it goes and depending on what kind of kidney you're getting and how difficult it is inside.
Okay, that's something that I thought of. Does it make a difference as to whether I receive a kidney from a live donor or from a cadaver?
Yes, it makes a lot of difference. Actually, the operation, the steps from 0 to the last step, they are the same.
Okay.
So the difference is that the difference in the quality of kidney that you are going to get. First of all, we don't need to remove your kidneys, okay?
Oh, okay.
So you are going to keep the 2 kidneys that you have, and you are going to receive the
An
new
extra
kidney.
one.
The new kidney that you are going to receive is going to be an extra one.
That
The
sounds
third
a little
one,
strange.
okay? So usually the way that we put in the lower part of your belly,
okay,
kind of close to your hip.
Right.
Okay, it goes about here. The surgeon usually do a straight line or a hockey stick line.
Okay.
All right, about this size. So it goes about this long. So it's about 5 inches long.
Okay.
Okay, for us to be able to work inside and actually fit the kidney in.
The risk of problems from surgery is less than 5%, and the risk of death is less than 1%. Possible risks from surgery could include problems from being put to sleep, infection, fever, bleeding, and blood clots. Like other surgeries, you will have scars, pain, and fatigue. Every effort is made by our surgical team to reduce these risks.
What other risks do I need to be concerned about?
Well, after transplant, you might feel overwhelmed learning how to care for your kidney. You may feel upset or angry if your donated kidney isn't working well. You may also feel worried about the cost of the medications. It's important that you remain in contact with a transplant social worker to get support.
Though some people probably very scared in order to do the, kidney transplant. What if it is not last long, and what if I'm going to fail again?
I wouldn't want the donor to be, or the recipient to be afraid, because there's nothing that I'm doing this out of my own heart, and if it doesn't work, it's beyond my control, and I can only do as much as I can do, and it's something I would give no matter what.
When I got the first call for the transplant, it was like about 5 in the morning, and they told me not to eat or drink anything because there was a chance, there was a kidney and a pancreas for me. So that's what I did. They called me around 4 in the afternoon, and they asked me to come right away.
When it finally came to that time for me to get a kidney, and I thought it was the right one, I was really ready. But it was some fear. And I'm not going to tell you no lie, it was some fear.
We were admitted to the hospital the day before, which was January the 4th. The next day that I had my transplant scheduled was my birthday. So that made a special birthday present for me that my son gave me.
It's the first time I was looking forward to surgery.
I remember being in the hospital. I remember she and I on gurneys going to the operating room, joking all the way, and laying in the pre-op room. We're separated by a curtain, and we're still cracking jokes with each other.
Well, the good thing that I remember, it's when the doctor woke me up, when I was the day of the surgery. For me, that's when my life changed for good. When the doctor woke me up, and I asked him that when was the surgery going to start, and he told me the surgery was over.
When I first woke up after the surgery, I felt so much better. I couldn't believe it. It was instantaneous. I could tell the difference. And people had told me that, okay, when you wake up out of the surgery, if the kidney is functioning properly, you're going to feel like a new person. And I did. It was amazing. I was still in the bed. I still couldn't get up, but I felt so much better.
I definitely knew that something was going on because the level of activity had picked up greatly. So I was in intensive care, I think, most of the night, and then they got me back to a room the next day. And, obviously I knew that it hadn't worked. It was disappointing it didn't work. We were all depressed for a while. I don't think you ever completely get over something like that.
I never regretted donating. I still don't ever regret donating. Kim's would have never worked had I, or whomever would have donated the next time if we hadn't found out the first time about the serum sickness, or Kim could have gone first, and then it would have been her. So it wasn't because it was my kidney.
Right after I had a surgery done, I can go to the bathroom my own. It is kind of funny things, but I peed, and the smell comes to me. It was so good.
They brought me spaghetti for a dinner. I was like, what can I have to eat? And they asked me, they said, well, in fact, it wasn't spaghetti. It was muscatoli with meatballs. And I'm like, lots of sauce. And that's something you can't have when you're on dialysis if you're following the right diet. And that's what they brought me. And I had soda.
When I was in the hospital with the transplant, I told my family, I want a fruit tart. When I get home, I want to have a fruit tart with berries. And that's exactly what I had. When I came home, they had a whole, and I ate it all by myself.
How bad do you think the pain is?
You will often feel the most pain the first few days to 1 week after surgery, and we'll give you medication for any pain that you will have. Many recipients tell me that they start feeling better quickly because they have a working kidney. And then over time, in the next few weeks, pain lessens, and usually patients tell me that they're able to return to their normal activities in about a month.
At first, I was in quite a bit pain, so I had pain pills, which helped out a lot. But after like a week, I started feeling much better. Then I like a week and a half, I came back up here and they removed the drainage tube. And after that, I was like a new woman.
There will be a transplant team that will train you in everything you need to know. There was no question in our minds when we left that hospital that we had this under control.
Transplant is a treatment, not a cure. Part of the treatment means you have to take immunosuppressive medications.
I take them at 8 o'clock in the morning, 8 o'clock at night. You know, I have my watch set for when they go 8 o'clock at night. Because you gotta remember, you gotta take your pills. There isn't no, well, I'm going down fishing for 2 days and forgetting your pills. There's none of that. You remember your pills.
What are the side effects for taking the anti-rejection medications?
These medications can have side effects like tremors, trouble sleeping, weight gain, hair growth, nausea, and headaches. The medications can also put you at risk for other health problems such as developing cancer, diabetes, high blood pressure, and high cholesterol. Many side effects, though, can be avoided with proper precautions or treated with changes in medications.
That's why I need to stay in contact with my doctor and the team.
Yes, we really need to work together now and going into the future together. You want to make a plan to avoid the sun and wear sunblock to lessen the risk of skin cancer, the most common type of cancer for transplant patients.
Being immunosuppressed, you have to watch out for yourself. And I have a number of skin cancers that I've had due to the medication.
Fortunately, the experts that take care of you are aware of these risks and will be monitoring for them and will be quick to intervene if you encounter them.
Now I see my surgeon once a year. I see my nephrologist every few months, which is really good. The visits gotten shorter. I go back to the dialysis center, even though I've had my transplant. I just want to show them that I can go swimming like I used to. I can go out. I can do so much more now.
I feel better. My shortness of breath gone, my swelling gone, my energy is back, and we turn around almost to normal again. 180 degrees from bad, short of breath, weak to active, dancing every weekend, and we go all around wherever. We told our friends, don't invite us, because if you invite us, we'll be there. So we went all the way, we just came back from Ohio dancing. Last month we were in Wisconsin dancing. And then next month we're going to San Francisco dancing again.
I can traveling. I have much freedom. I don't have to go back home about 9 o'clock, put myself into the machine. I don't have to go back to hospital every other day and hook myself into the machine for like 4.5 hours. I don't have to do all that.
After the transplant, I was able to go back to college and get my degree, go to work, move to the big city, start doing sports again, bought a house. I'm enjoying life. Life is good.
The little things are back. We can be more physical with each other than we could before. And I say that with all the comfort in the world, because there was a point in our physical life that was terribly limited.
After I got the kidney from her, and she came up and she put her arms around me and she goes, I got my Tim back. That's what she said to me.
What if my kidney transplant fails? What would happen?
What I didn't know at first was that kidney rejection often can be slowed or stopped with changes in medication. This is why it's important to stay in contact with your transplant coordinator. If you lose the kidney transplant, you will need to go on dialysis. Now, are you on dialysis now?
Yes, I am on dialysis.
Okay, so you would return to dialysis, and many dialysis patients are eligible to receive another transplant if their kidney stops working.
The doctors told me it looked like your kidney has run its course. Even though we was able to control the virus, you had it for 10 years, you're going to have to get you replaced on the list. You're going to need another transplant. I'm going to do it again. I'm going to do it again. I'm going to go through the process. I'm on dialysis now. I'm on the list. and I'm still living my life.
If I hadn't have gone through the experiences that I have gone through, dialysis, transplant, and everything else that was in between, I don't think that I would fully appreciate the life that I have now.
Transplant has been able to give me the opportunity to coach my son's baseball team. If I was on dialysis, I mean, be lucky to get to first base, if that. I mean, now I can, you know, on the ball field, keep up with my son, actually, you know. I can run the base, I could run, you know, from home to home, you know, I mean, just like I used to be able to.
Before transplant, I didn't have no hope because I thought that I'm gonna go pretty soon. But now, I have great hopes. I can't plan for tomorrow.
10 years. This is the anniversary of my kidney transplant.
Christine, is that what it's really like to go through transplant evaluation and surgery?
Definitely. The video gives a great overview of what happens when a patient comes to a transplant center.
I know the evaluation process can take months to a year to complete, depending on the health of the recipient and how quickly the test can be scheduled. This brochure, What You Need to Know About Kidney Transplants, gives patients a lot of information, including some steps that they can take next. But I have another question for you. How do dialysis and transplant compare?
Well, patients who receive a kidney transplant tend to live longer than patients who remain on dialysis.
And how does a deceased donor transplant compare to a living donor transplant?
A kidney from a living donor will last longer than from a deceased donor and can be matched quickly and requires less time spent on dialysis. Remember, there are many risks involved with transplant that should be carefully considered.
If someone has a question, can they just call a transplant center, even if they don't know if they're going to get a transplant yet?
Definitely. We want you to have all the facts. We're always happy to help.
Now, please join us in watching the third video in this series, What You Need to Know About Living Donation.